My name is Eric Benari, and this is Games People Play. In this episode, we're going to play the game Wooden Leg. The most dramatic form of Wooden Leg is technically the Plea of Insanity. This may be translated into transactional terms as follows. What do you expect of someone who is emotionally disturbed as me? That I would refrain from killing people? To which the jury is asked to reply, certainly not. We would hardly impose that restriction on you. The Plea of Insanity, played as a legal game, is acceptable to American culture and is different from the almost universally respected principle that an individual may be suffering from psychosis so profound that no reasonable person would expect him to be responsible for his own actions. In Japan, drunkenness, and in Russia, wartime military services, are accepted excuses for evading responsibility for all kinds of outrageous behavior. The thesis of Wooden Leg is, what do you expect of a man with a wooden leg? Put that way, of course, no one would expect anything of a man with a wooden leg except that he should steer his own wheelchair. On the other hand, during World War II, there was a man with a wooden leg who used to give demonstrations of jitterbug dancing, and he was a very competent jitterbug dancer, and he used to go to army hospital amputation centers and perform. There are blind men who practice law and hold political offices, deaf men who practice psychiatry, and handless men who can use a typewriter or a computer. As long as someone with a real exaggerated, or even imaginary disability is content with his lot, perhaps no one should interfere. But the moment he presents himself for psychiatric treatment, the question arises if he is using his life to his own best advantage, and if he can rise above his disability. In this country, in the United States, the therapist will be working in opposition to a large mass of educated public opinion. Even the close relatives of the patient who complain most loudly about the inconveniences caused by his infirmity may eventually turn on the therapist if the patient makes definitive progress. This is readily understandable to a game analyst, but it makes his task no less difficult. Both sides are illustrated by the case of the stuttering client. The man who played the classical form of wooden leg. He was unable to find employment, which he correctly attributed to the fact that he was a stutterer, since the only career that interested him, according to him, was that of a salesman. As a free citizen, he had a right to seek employment in whatever field that he chose, but as a stutterer, his choice raised some questions as to the purity of his motives. The reaction to a helpful agency when someone attempted to break up his game is very unfavorable. Wooden leg is especially pernicious in clinical practice because the patient may find a therapist who plays the same game with the same plea so that progress is impossible, thus proving that psychiatry can't help people. Some of the pleas which patients use to excuse symptomatic behavior are colds, head injuries, situational stress, the stress of modern living, American culture, and the economic system. A literate player has no difficulty in finding authorities to support him. I drink because I'm Irish. This wouldn't happen if I lived in Russia or Tahiti. The fact is that patients in mental hospitals in both Russia and Tahiti are very similar to those in American state hospitals. Slightly more sophisticated are such pleas such as, what do you expect from a man who comes from a broken home, is neurotic, is in analysis, or is suffering from a disease known as alcoholism. These are topped off by, if I stop doing this, I won't be able to analyze it, and then I'll never get better. Let's discuss the antithesis. Anti-wooden leg is not difficult if the therapist can distinguish clearly between his own inner parent and inner adult, and if the therapeutic aim is explicitly understood by both parties. On the inner parental side, he can be either a good inner parent or a harsh one. As a good inner parent, he can accept the patient's plea, especially if it fits with his own viewpoints, perhaps with the rationalization that people are not responsible for their actions until they have completed therapy. As a harsh inner parent, he can reject the plea and engage in a contest of wills with the patient. Both of these attitudes are already familiar to the wooden leg player, and he knows how to extract the maximum satisfaction from each of them. As an inner adult, the therapist declines both of these opportunities. When the patient asks, "What do you expect of a neurotic," or whatever plea he's using at the moment, the reply is, "I don't expect anything." The question is, what do you expect from yourself? The only demand he makes is that the patient give a serious answer to his question, and the only concession he makes is to allow the patient a reasonable length of time to answer it, be it anywhere from 6 weeks to 6 months, depending on the relationship between them and the patient's previous preparation. Thank you for watching. I'll see you in the next game that we will play.